Welcome to our Join in the Fun videos to help you with hip pain and hip arthrosis. First, I'll explain the cause, and then we're going to do 2 special fascia rolling massages for this area, and at the end, 2 more exercises that'll take you out of those stressful hip situations. What's happening to your hip? It's the sitting. It's always the sitting. It's a very big problem for our hips because when we sit, the hip flexor becomes shorter. The muscle here that runs over there, over this little bump here, and along the groin to the iliac bone and the lumbar spine. Here you can see the connection between hip pain and back pain that often appear together because they're linked by muscle and fascia. And when we stand up now, our body bends forward on account of this shortened muscle here in the front, and so your buttocks have to counterpull, and that creates an ever-increasing area of tension between hip flexor in the front and buttock muscles in the back. And being caught between these forces, the head of the joint is pulled in even more, and as you can imagine, with this increasing forces, you have wear and tear, pain, arthrosis, all those things you just don't need. So what are we going to do? We're going to do 2 fascia rolling massages. Let's pick a roller from our fascia foam roller set, the so-called midi ball. And Ina, please come on over here. You wanted to work on your left side, not like this. Please turn around and please sit down. And now, take the ball, or something similar, a tennis ball, for example, in case you don't have this ball yet. But a tennis ball would be a bit too small, so that you should take something slightly bigger. Maybe a children's ball or your dog's ball or something like that. If you don't have this ball here, take something similar and then simply sit on it. Sit on it and move around. Carefully at first, move back and forth and search for tender spots in your buttocks. Let me go over there. It's easier to show you that way. And slowly work over this surface and stay on the spots you feel are sensitive. You could feel it, right? Almost everybody is sensitive there. Why? I explained it a minute ago. You'll find some spots, I assure you. And now try and move in spiraling motions. And in doing so, you squeeze liquid out of the area, spread it in a spiral pattern, so that fresh water can trickle through the system and dissolve excessive acidity concentrations there. And that makes it much easier to start your exercises. And we also catch little receptors, little sensors that help to relax everything there. So this here is a perfect preparation for the 2 exercises we're about to do later. Many patients declared this their official position for watching TV. You don't sit on the couch anymore, where everything becomes shorter, but on the floor and on the ball or the roller, and make good use of your TV time. Keep looking for spots where you can trigger a bit more. To the outside a bit, just move around and try. You can also, we showed you the exercise on the floor because there's more space to move around. You can also put the ball on a chair and do the exercise on a chair. But on the floor, you just have more room. So if you have a floor for the exercise, use it. You're finding more and more spots, right? Because this column of pressure, this tissue pushed together, that is, moves deeper and deeper and can clear up a lot. Okay. Now get off the ball. And please turn to the camera. I'm going to get you the smaller ball. We'll use this smaller ball to do the following. Here you could see the inside of her upper thigh, here the transition to her groin, and at about here, do it yourself, Ina, we place the ball. It's best to use both hands. You can also do this on a chair if you like. Use both hands and go deep to find an area that is sensitive. Go a bit to the outside to find more. It's even more sensitive there, right? There's one spot more on the outside, the outer third of your leg, which is extremely unpleasant. And that spot is important in this exercise. Go and search around this area for sensitive spots. You don't have to wander too far. Just try and use spiraling motions to get deeper with this column of pressure. The deeper you can go, the better the effect later. If you move around here, go hunting for sensitive areas. And if you approach the spot from different angles, you'll notice how sensitive it is. And this is where we're going to stay. And then, please lie on your back. Watch your head. Maybe slide down a bit towards the end of the mat. Right. And now, work on your groin a bit, where you can feel this bony edge, the iliac spine, and look for spots there, below this bone there. And here you can often feel a very sensitive spot, which you should approach very carefully. And the more you feel, this isn't so bad, the bolder you can become, and then press on it with some real power. The moment it feels unpleasant and you think, this doesn't feel right, when this feeling moves up to a 10 on your personal pain scale, then release it a bit and move on to another spot. So never keep on going when you feel something's not quite right, because that would increase tensions via your brain response mechanism, and that would run counter to everything we're doing here right now. I guess you could feel the spots that are really sensitive, right? Okay, then please sit up. I'll get you a chair. Please hand me the ball. Now, let me think for a minute. You want to work on your left leg? So, we're going to put the chair right here, or even better, like this. Let me show you. Take this position. Wait, the camera is over there, so we should change positions to the left side. Let's put the chair in the back so they have a better view. Please take this position and hold on to the chair. And I'll explain in a minute how to do the exercise. And you at home, please do the same. Find something to hold on to. I'll give you a minute, so go and get a chair. And as soon as everything is ready, then pay attention to the following. This exercise is a bit complicated, so mind the details to get an optimum effect from it. You take a knee like this. If it's too hard on your left knee, put a pillow under it and bring your left upper thigh into a straight line. Your torso above should also be straight. I'm talking about this line here. And put the other leg like this, with your foot a bit further out. Yes, that's good. And then that gives you more room for the exercise. And now I'm pushing Ina forward the way it's supposed to be. Please make sure that your lower back is completely straight. The most common mistake here would be a hollow back, because then you would avoid exactly the stretch that is of such great help for your hip. That means visualize your left groin going forward. It wants to move forward. Move your left groin forward, Ina, and you leave your body as it is. You don't move it forward. You stay straight and move your left groin forward. And then you can immediately feel a stretch going in your left upper thigh, a good stretch. And in this exercise, it's more about small but correct movements rather than big sweeping ones. Tuck in your stomach. That's a good trick to prevent a hollow back. This point, your groin is moving forward. As soon as you're arching your back and can't keep straight anymore, you move back a little. Reset everything, tilt your hip forward, yes, and then move forward with a tilted hip. It's difficult to control, right? The other hand on your stomach, make sure that you won't stick it out because that would mean you're arching your back, and that would defeat the purpose of this exercise. You could feel it, right? Good, stay on it. As you can see, she's moving only inches because this muscle is so compact. With so many fibers, it's hard to pull apart and lengthen. But this is the most effective exercise for it. Slowly move forward, inch by inch. Always check for a correct position. Bring your hips up straight if they're off. For a couple seconds more, and we're done here. And slowly release. This is hard work. And now, let's take care of the other side. Please sit in the chair. Let's put it over there. Get the mat out of the way. So, please take a seat on the edge of the chair to give you enough space for your legs. And now, we want to stretch your buttocks so that the other pull that tends to mess up your hip is also being worked on. So please cross your legs. Great. Easy does it. And now, put one hand on your right ankle and the other hand on your left knee and listen. Stay straight. Absolutely straight. And now, slowly bend forward, but stay straight. Stop. That was enough already. That means the change in the angle has to be here in the hip joint, not in your lower back. You try and arch your back as much as you can. So form an extreme hollow back while you do the exercise, and then slowly bend over and take your pelvis along with you. And Ina, you could feel a pronounced stretch in your left buttock. Yes. Gradually bend over even more. The buttock muscle is a short muscle, and it has lots of fibers side by side, and that's why it's so important to take your time and not assume other angles, but to make small changes in the angle that you're at while staying in the correct position. The stretch is getting stronger, right? Lean into it, but very slowly, but always with an arched back, and take your entire pelvis along with you. Okay, and now, stay in this position. Don't give it up. You're doing great. And now, move a bit to the left. Forward, don't turn. Just shift to the left, and you could feel a change in the back. Do you feel more or less of a stretch? More, right? That's exactly the point. If you feel a stronger stretch like Ina does, then move to the left a bit. That happens often, that you work on fibers that are even more involved than others in this situation. And a bit more. Great. And use your breathing. Breathe in deeply and stay. And when you exhale, lean in a bit more. Great. This exercise demands precision, but it will be very effective. You're going to feel it afterwards. Then slowly get up again. Great job, Ina. Good control. I hope you were able to follow us at home. If you liked our video, give us a thumbs up, subscribe to our channel, and visit our website for more exercises and tips. Liebscher-Bracht.com